My name is Cary Franklin. I'm a professor of law at UCLA, and I'm the faculty director of the Center on Reproductive Health Law and Policy. On my mind is the fact that what your rights are now heavily dependent on what state you live in. So Californians live in a state where the reaction to this decision will be to increase protection for reproductive health care and rights, to try to make sure there's enough funding, there are enough providers, that people will not be prosecuted for pregnancy outcomes, that their privacy is protected. And if you live in a state such as Alabama or Mississippi, you have just had your rights stripped away from you. And if you don't want to carry a pregnancy to term, even in cases of rape or incest potentially, certain conditions with the fetus, severe mental health strains, the state may ban abortions in all of those contexts, and people will be in very dire straits. The most vulnerable people have just been rendered more vulnerable, particularly since a lot of the states that will restrict or ban abortion provide very little in the way of support in terms of healthcare, in terms of food, in terms of childcare. And I think it will be a lot of suffering in some states.
Is California poised to alleviate some of that suffering? I see the report that says anywhere between I believe 8,000 and 16,000 people additionally per year could come here.
Yes, our center has just put out a study showing that I think there will be thousands and thousands of people coming to California to seek care from surrounding states where bans are implemented. Fortunately, the California legislature has seen this coming, so they have already been working on a package of about 12 bills and also now a constitutional amendment to ensure that not only Californians, but also all the people who come to California will get the care that they need. So I think the governor has said this will be a top priority. Funding will be allocated for it. And the message from the state, from Planned Parenthood, from providers is, we will help you get the care that you need.
To your knowledge, is our reproductive healthcare system here in California already overtaxed? I know one concern is, we already have Californians seeking abortion, and now we're going to have this influx of people from out of state.
It is true that access in California isn't as great as it should be, and that in the northern and western part of the states in particular, you may have to travel a long distance. But as I said, legislators and providers have been anticipating this for a long time. So there are programs already in place to expand the number of clinics, to increase funding for uncompensated care that's provided, to even provide transportation and hotels in some circumstances to meet the need.
And in the interest of your voice here, I'll wrap it up with a final question, which is simply, in the report, is there anything else that really stands out to you that you think people should know?
I think that one thing people should know is around 75% of people who get abortions in this country are at the poverty line or below. And this decision will profoundly affect poor women, women of color, rural women, undocumented women. The most vulnerable people in society have had their rights stripped away. Not everyone will be able to come to California, and not everyone in this country will be able to get the reproductive health care that they need as a result of this decision. And those are the women that are on my mind today.